Welcome to the Therapy Trainings Podcast, where we dive deep into topics that matter to mental health professionals, counselors, and therapists. I'm thrilled to have you here for this companion episode to the course Understanding Smartphone Addiction offered by Therapy Trainings. Whether you're a seasoned expert or just beginning your journey in mental health, today's discussion will provide valuable insights into an issue that affects nearly everyone today: smartphone addiction. In this episode, we'll explore what smartphone addiction really is, how it manifests in our lives and the lives of those we serve, and why it's important for mental health professionals to understand this phenomenon. We'll also tackle common misconceptions surrounding smartphone use and addiction, and I'll share some practical strategies to help clients manage their relationship with technology. By the end of this episode, you'll have a clearer picture of smartphone addiction and some tools to help your clients navigate their digital lives more effectively. Let's start by defining what we mean by smartphone addiction. Often referred to as nomophobia, which stands for the fear of being without your mobile phone, smartphone addiction can manifest in various ways. Some individuals may find themselves compulsively checking their devices, feeling anxious when unable to access their phones, or neglecting personal relationships and responsibilities in favor of screen time. Research suggests that over 50% of adults report feeling anxious without their phones, and this number is even higher among younger generations. It's crucial to recognize that smartphone addiction is not merely about excessive use. It's about the impact that this use has on an individual's mental health and well-being. One of the most significant ways smartphone addiction can affect mental health is through its relationship with anxiety and depression. A growing body of evidence suggests that increased smartphone use is correlated with higher levels of anxiety and depressive symptoms, particularly among adolescents. It's important to note that this is not a straightforward cause and effect relationship. Instead, it's a complex interplay between technology use and mental health that we as professionals need to understand. As mental health professionals, we can help our clients identify their patterns of smartphone usage. Ask them questions like, how often do you check your phone? Do you feel anxious or uneasy when you can't access it? Are there specific apps or notifications that draw you in? Encouraging clients to reflect on their usage can foster greater self-awareness and open the door to conversations about the impact of their habits. Now let's transition to the second point: the role of social media in smartphone addiction. Social media platforms are designed to be engaging and addictive, employing a variety of techniques to keep users hooked. The endless scrolling, notifications, and likes create a feedback loop that can lead to compulsive behavior. This can result in feelings of inadequacy, loneliness, or even jealousy as clients compare their lives to the curated versions of others they see online. Consider this. When was the last time you heard someone say, "I just love how I feel after spending 2 hours scrolling through social media"? Instead, we often hear complaints about the anxiety or sadness that can follow a binge of social media use. It's essential for us as professionals to highlight these emotional responses and help clients develop healthier relationships with social media, whether that be through setting time limits, curating their feeds, or practicing mindfulness when engaging with online content. But it's not all doom and gloom. There are effective strategies we can encourage our clients to adopt in order to combat smartphone addiction. One such strategy is establishing phone-free zones or times, whether it's during meals, family time, or even an hour before bed. Creating designated times where smartphones are put away can foster deeper connections with others and contribute to better mental health. Another practical technique is encouraging clients to engage in digital detoxes. This doesn't mean they have to abandon their phones entirely, but rather take intentional breaks from social media or certain apps. A weekend away from screens can provide a fresh perspective and a break from the constant stimuli of notifications. Now let's address some common misconceptions surrounding smartphone use and addiction. One prevalent myth is that smartphone addiction is only a problem for young people. In reality, smartphone addiction can affect individuals of all ages, from children to seniors. While the ways in which people engage with technology may differ, the potential for addiction and its associated mental health impacts are universal. Another misconception is that smartphone addiction is simply a lack of willpower. This viewpoint oversimplifies a complex issue. Addiction, whether it's to smartphones or any other substance or behavior, often involves underlying psychological factors. By framing smartphone use as a moral failing, we risk alienating clients who may feel shame rather than understanding. Instead, we should approach the topic with empathy and awareness, recognizing that these behaviors are often coping mechanisms for deeper issues. So, how can we as mental health professionals address these misconceptions? First, it's important to stay informed about the evolving landscape of technology and its effects on mental health. Incorporating recent research and trends into our practice can help us provide better support to our clients. Additionally, fostering an open dialogue about technology and therapy can empower clients to discuss their struggles without judgment. As we wrap up today's episode, I want to leave you with some thought-provoking insights. The relationship we have with our smartphones is a reflection of the larger societal changes we're experiencing. While technology can enhance our lives, it can also detract from our mental health if not managed mindfully. As mental health professionals, we have the unique opportunity to guide our clients through these challenges, helping them to reclaim their time and attention. Remember, the goal isn't to vilify technology, but rather to encourage healthy engagement with it. Encourage your clients to reflect on their smartphone usage habits and the impact these habits have on their emotional well-being. By doing so, we not only empower them to make more mindful choices, but also help them cultivate a more balanced and fulfilling life. If you're interested in diving deeper into this topic, I highly encourage you to explore the course Understanding Smartphone Addiction offered by Therapy Trainings. You'll find a wealth of knowledge and practical strategies that can enhance your practice and support your clients in navigating their relationship with technology. Thank you for joining me today on the Therapy Trainings podcast. I hope this companion episode has provided you with valuable insights and practical takeaways. If you enjoyed today's content, be sure to visit therapytrainings.com for more courses that can help enrich your professional development. Together, let's continue to support our clients in leading healthier, happier lives in this digital age. Until next time, take care and stay connected mindfully.